presenting today Heatstroke in the Tibb Talks session. Is it fine now? All right, so Heatstroke. Whenever the summer comes, we always read about it. We watch on the TV that they've been talking about the heat stroke. So what exactly the heat stroke is? What's the difference between the heat stroke, heat exhaustion, heat cramps, the other heat-related illnesses, and how to manage it? That's our main aim to get it from this session. So now first, let's talk about the environmental heat exposure is a serious health hazard that is responsible for more deaths than all other natural disasters combined. Heat stroke incidence has increased dramatically during the past few decades, and it will continue to do so because of the global climate changes and also the expansion of urban environments. Now, the first thing which is going to come in the mind, if I was sitting here, I would have asked, how come heat stroke can cause more serious health hazards and is responsible for more deaths when we always reading about the floods, reading about the earthquakes? So the thing is that heat stroke itself doesn't cause much deaths. The main thing is the heat-related illnesses. Like it can cause problems in people who are already having other kind of sickness like cardiac sickness, renal dysfunction, or someone having an endocrine abnormalities. So let's move on. Heat wave. What is heat wave? Heat wave is 3 or more consecutive days during which the air temperature is above 32 degrees Celsius. Heat stress is a perceived discomfort and physiological strain associated with exposure to a hot environment, especially during physical work. Heat stroke is a severe illness characterized by a body core temperature of above 41 degrees Celsius and central nervous system abnormalities. Now, I remember when I joined the medical school, my neighbor called me and he said, "You know what, Ali, I got a heat stroke." So, okay, to be honest, I didn't even had much idea about the heat stroke, and I said, "Okay, fine, you got heat stroke, what you did?" He said, "I just took 1 Panadol and I got better." Okay, I said, "Fine." Then later on, I asked myself, why do we call heat stroke as a heat stroke? All right. So basically, heat stroke, we all know about the stroke. It's a central nervous system illness. So when the heat has caused the effects in the body that our central system has got involved, then it becomes heat stroke. So we can read here that when the central nervous system abnormalities such as delirium, convulsions, or coma resulting from the exposure to the environmental heat, then it's called the heat stroke. We're going to move on. Heat exhaustion is a mild to moderate illness due to water or salt depletion that results from exposure to the high environmental heat or strenuous physical exercise. Signs and symptoms include intense thirst, weakness, discomfort, anxiety, dizziness. Hypothermia is a rise in the body temperature. Normally, our body temperature is being maintained by the brain. There's an area called hypothalamus, which has been controlling our body core temperature. So whenever there's a heat gain, it's always adjusting that we get the appropriate heat loss. So when the high temperature, they affect the brain, the brain controlling mechanism, it fails. And that's when we get all these multi-organ dysfunction syndromes. Now, quickly, heat-related illnesses. I talked about the heat stroke, heat exhaustion, heat cramps, sunburn, heat rash. Now, yesterday when I was in emergency department, I got a young male, 24 years old male, and he said, "You know what, doctor, I'm feeling very hot. I had 2 episodes of vomiting. I do have stomach cramps. Don't you think that I have a heat stroke?" So then I just asked him, I said, "Okay, tell me what the heat stroke is." He said, "This is what I heard about, that when you get feeling of getting too much hot and you've been exposed to the hot weather." Then I told him that, listen, this is not heat stroke, this is heat exhaustion. All right, this is basically a mild to moderate illness, not as severe as the heat stroke is. Heat cramps is something normally we do get, we going out in the hot weather, we getting a lot of sweat, we lose a lot of water and salt. This is what ends up, the heat cramps. Sunburn, mostly I remember when I was not in Pakistan, whenever we were going for the swimming in the summer, we were getting these sunburns when we were getting exposed to the sunlight. So these are the painful red and warm skin, blisters on the skin. And the treatment is very simple. You stay out of the sun and until your sunburn heals. Same here, the heat rash. We do get it whenever we get exposed to the hot weather. All right. We're going to talk about the classification, risk factors, and epidemiology of the heat stroke. There are two things written here: classic heat stroke and exertional heat stroke. Now, what is classic heat stroke and what is exertional heat stroke? Classic heat stroke is basically caused by the hot weather, whenever like someone getting exposed. And exertional heat stroke is when our body metabolic rate is very high and our body core temperature gets raised. When I was making this assignment, I just read news that last week there was one athlete in United States. He died because of the heat stroke. So I got amazed. I said, such a developed country, and an athlete inside the training area, he died because of the heat stroke. So what basically happened? He was assigned a duty by his coach. He couldn't perform it well, and he requested for the water. He wasn't allowed, and what happened? He collapsed. He died because of the exertional heat stroke. That's basically more common in the post-pubertal and active people, and because of the strenuous exercise, it mostly happens in the generally healthy people, and mostly there's no any history of any past illness or chronic illness. So this is the exertional heat stroke. So now this thing I'm telling you so that we must get cleared is not that only like underprivileged people, maybe the people who are working in the labor class, mostly working as a gardener, maybe working on the roadside, they are the ones who are prone to the heat strokes. Even well-off people, they can get this thing. If they're working in summertime, they're over-motivated, they're doing some strenuous job, they can get this. Now, the mechanism is, in the classic heat stroke, we get the absorption of environmental heat and poor heat dissipation, while in the exertional heat stroke, we're getting the excessive heat production, which overwhelms the heat loss mechanism. So it's more about all the medical terms, and what I see here that most of us sitting here, they are more from the HR and IT department. So I'm going to skip this portion and we're going to come back here. Now we're going to talk about the risk factors. The risk factors here, the classic risk factors are the heat waves with successive hot days and nights. The physiological factors are the cardiovascular insufficiency. The social factors are the social isolation, unventilated or non-air conditioned living space, inability to care of oneself, and confinement to the bed. So the thing is that like someone old age, staying alone, not having proper ventilation at home, he's at more risk to get heat stroke. And especially those people who are on antipsychotic medication, antidepressant medication, and they're not been looked after well, they're also the ones who can get this heat stroke thing. Now the underlying illnesses is some psychiatric issues, cardiovascular, cerebrovascular, pulmonary illnesses, the other immune-mediated sicknesses, the medication, all those medications which interrupt with the body metabolic rate, they can cause it. Especially the medication for the heart illnesses, the medication for the psychiatry illnesses, on the antidepressants, they also get this. Now we're going to talk about the exertional. So this is especially for the HR people. Yeah, you can see here, over-motivation, peer and coach pressure. So now when I was talking about that athlete who died in States, this is what it was. He was assigned a duty, he couldn't do it well, he wasn't given the water he asked for, and he died. So please don't over-motivate people, and if they don't perform well, do allow them to eat well and maybe hydrate properly in the summertime. Now the functional factors are the low physical fitness. I'm going to give you an example. Like most of us, it's summertime, we always listen that in summer it's very easy to lose weight. So what we do, we start gymming. We're not used to it. We're going to go there. We're going to get exposed to the hot environment. Our body also going to make a lot of heat. And this is what's going to happen then. So low physical fitness, lack of acclimatization, like someone who just came from overseas. We do get such cases in the emergency department. They tell us that, you know what, I just recently came from States, I recently came from Canada or UK, and I went to my village and see what happened now. I'm getting the body cramps, I'm weak, I'm getting nausea, vomiting, because they were not used to it. So we always tell them that, listen, when you come to a new place, first adjust yourself, all right? For example, like someone staying in the northern areas decides to go and stay in, let's say, Sibbi or Multan, you know, the hot places. They're not supposed to start doing like their routine work. They have to get used to it before they go going. So lack of acclimatization, low work efficiency, overweight. Acquired factors are the viral or bacterial infection, dehydration, sleep deprivation, sweat gland dysfunction, burns. There are a few drug abuse things, mostly these recreational drugs and alcohol. Now we're gonna go into the pathophysiology, pathogenesis. I'm gonna go like very layman terms. I'm not gonna go into the medical terms. It's very simple that whichever like organ we've been working on, our body gonna give more blood supply. All right, let's talk about someone eating. What's gonna happen that the blood supply gonna go more to the gastrointestinal tract, so that the nutrients they can get supplied to other parts of the body. So same here, what happens that when you're getting exposed to the heat, increase metabolic rate, you increase core body temperature, you have increased cardiac output, and then increase skin blood flow. So what happens, you're getting the increased blood flow towards the skin, which causes the decreased visceral blood flow, and it causes then the havoc. What happens, you're getting this cell destruction, you're getting the gastrointestinal permeability increase, you have the cardiovascular collapse, inflammatory reactions, and it's gonna lead to the heat stroke. So very simple, because our skin being utilized to use the extra heat. This is what happens then, we're getting the increased skin blood flow, decreased visceral flow, and all these catastrophic responses then they start happening. Now the diagnosis. This is a problem. Being a medical professional, even like for people who are not related to the medical field, how to diagnose it? How to diagnose that this person is either having a fever or it's the heat stroke. Now the diagnosis is clinical based. It's primarily the three things. One, as I said before, heat stroke means stroke, the neurological abnormalities. You see something like, you know, that this person was fine. Now getting exposed to the heat, I can see that there's an altered level of consciousness. And then there is exposure to the hot weather, and there are also like hypothermia. The body core temperature is raised. You're gonna find out the central nervous system signs, confusion, delirium, fits. You're gonna have a tachycardia, arrhythmia, means a high heart rate, and the other abnormalities, all the medical terms being used here. It's going to be a metabolic acidosis, respiratory alkalosis, hypoglycemia. The thing is that sometimes, even being a medical professional, if someone comes with a heat-related illness, we do make mistake. Maybe he been exposed to the heat, that's why the body temperature is high. Maybe it's the heat exhaustion. But what we think that, oh, it's summertime, maybe he's getting a typhoid, maybe he's having a malaria because we have a lot of mosquitoes in Lahore. But we're missing something. We're missing that maybe this person been exposed to the heat. But we starting all the antibiotics, we giving all the fluids, and we causing more problems. So now the treatment here, for all of us sitting here, if like you going on your motorbike or you're going on the car and you find someone lying on the roadside, so what you have to do, first always look for your own safety. Remember one thing for the emergency. But whenever you approach someone, always first look after yourself. You make sure that you're not like putting yourself in the danger. So when you approach that guy, if you find that he's sweating a lot, all right, he just vomited, and you find out that he's been working here, maybe he's working as a gardener or maybe a bricklayer. So what you do, first thing, move him to the cooler place, all right? So this is a sign that if he's sweating a lot, being exposed to the hot weather, it's most likely is the heat exhaustion. So take him to the cooler place, take off his clothes, and try that if he's conscious that he must drink a lot of water. All right. But in case of heat stroke, how are you going to find out that this is a heat stroke? His skin going to be dry, it's going to be reddish, It's going to be very hot. He won't be like sweating like the way he was like in the heat exhaustion. So that's the main difference you're going to find out. See, like in one case, you find someone who's been lying there. He's bit oriented, sweating a lot. There's been history that he was there in the sun for quite long. That's most likely the heat exhaustion. But where else you find someone, people are going to tell, you know what, Dr. Saab, he was all fine. Then all of a sudden he vomited. He first complained of the headache, vomited, he had sweat, and now see what happened. And you're going to find out that he's been having a dry skin, he's been red, and also the body core temperature is high. In such case, always call the ambulance. And the first thing is also move him to the cooler place. So we're going to talk about the management here now. So now on the site, what you do, if it's been cardiac arrest, then definitely you're going to do the CPR. You're going to monitor the body core temperature. If the ALS, the ambulance team arrives and they do have the medication, the life-saving medication with them, they're going to start giving him the medication, which means maybe for the fits, for the seizures, they're going to evacuate him. And when the person arrives in the hospital, then the ED department, the emergency department, they're going to first make sure that he's been diagnosed properly, and they start giving him the appropriate medication. Now, methods of cooling, how the body basically is a conduction, evaporation. So we're going to even use the cold water immersion for such patients. We're going to apply the cold packs, the ice slush over the parts of the body or the whole body. We can use the cooling blankets. I don't think that we're going to have it here. We can use the ice gastric lavage, ice peritoneal lavage. We can fanning the undressed patient at room temperature, wetting of the body surface during continuous fanning, and use of a body cooling unit. So here all been methods used to basically cool the patient: conduction, evaporation, and convection. So if a patient comes in the emergency department, what we're going to do, we're going to put the water on and we're going to start the fanning. So the heat can go out with this method of evaporation. Prevention, how do we prevent it? People can, as I told before, they must get used to it. They must schedule their outdoor activities during cooler time of the day, reduce their level of physical activity, drink additional water, consume salty foods, and increase the amount of time they spend in the air-conditioned environments. Automobiles should be locked and children should never be left unattended in the automobile during the hot weather. All right. So these were all the bookish things basically we discussed about. All right, this is what we read in the books. Now, the practical things. As I said again, first we must differentiate what the heat stroke is, what the heat exhaustion is, what the heat cramps are. Now, I'm going to give you a scenario. Let's say a young male playing soccer outside in the school, and all of a sudden he starts vomiting and he's sweating a lot. So what's this going to be? Either it's going to be a heat stroke or it's going to be a heat exhaustion. So now in another scenario, let's say that maybe there's someone working as a laborer outside, and he complains of the headache, and all of a sudden he collapses. And when you touch him, you see that he's been very hot, and also he's been red, he's very dry. So what's this going to be? Either it's going to be a heat exhaustion or heat stroke. It's going to be heat stroke. So at least now we know what the heat stroke is. So next time if someone tells us, we know what the heat stroke is, what the heat exhaustion is, what the heat cramps are. All right. Second thing is that, like most of us sitting here, like if we planning to exercise or we want to do some kind of outdoor activities, I would say plan it after sunrise, after Fajr time, or either do it just before the sunset. Let's say between the Asr or Maghrib time, and drink plenty of water every day. Thank you so much. Any questions? No questions? Yes.